Hi, good evening. Hopefully you've managed to join successfully. Welcome to the webinar. We're going to wait a few minutes until everybody is with us. So if you've muted your microphone and turned off your camera, that's absolutely fine. If you would like to turn your camera on and give an introduction to the rest of the participants, you're more than welcome. We'll have a short introduction very soon. So welcome everybody. I can see some familiar names. We're just waiting for everybody to join us. So if you'd like to say hello, please feel free. Otherwise, I can see we have Belinda with us. Welcome, Dr. Kadour for the first time with us. So thank you for joining, Dr. Kadour. We also have Dr. Paye, Dr. Rosati, Dr. Isha, and Dr. Mimi. So thank you all. Feel free to introduce yourself and tell us from which beautiful country you are at the moment.
Hello?
Yes, hi. Hi, doctor.
I am Dr. Kadour. I am aesthetic GP from Algeria.
Hi, doctor. Nice to meet you.
Nice.
So you're still in Algeria. Have you been to Dubai before?
Yes, I come to Dubai in the April to pass the board exam from the American Academy of Aesthetic Medicine.
Okay. Mm-hmm.
And I have DHA eligibility later, and I'm planning to recollect to Dubai in this year's.
Okay. Well, that's wonderful. Welcome to the community. And we have a lot of aesthetic doctors amongst us in general. So we'll be more than happy to give you some very tailored advice for how to integrate yourself into the aesthetic medical community here. Very happy to have you with us. Do you have any specific questions today in particular? I'm going to have a lot of information to share, but do you have any particular questions on your mind?
Okay, the question. So I'm just worried about the job market. That's my only issue because here in Algeria I'm working in my private clinic, in my own clinic. So to take a decision, it's not easy to take a decision because in my clinic I am happy here. So I want to know more about especially the job market.
Yeah. Okay. The job opportunities and how difficult is it to find a good opportunity as well. I really understand. Yes. So we're going to discuss this evening. I mean, of course, there's as many opportunities as clinics, and I will give you some numbers. But for the aesthetic clinics, we have more than 1,000 aesthetic clinics already in the market in Dubai.
Yes.
And we could say that we definitely have one new clinic per week opening. So yes, it means that there are many opportunities and the market is growing, but it also means that there's competition for the clinics that are in business. And it means that the doctors working for those clinics need to be very strong as well and, work in partnership and good team with the clinic in order to build a good business together.
Yes.
So I will explain more on this. Thank you for the introduction, Dr. Kadour. Is there anyone with us would like to give a warm introduction? I can see we have many countries represented. We have Italy with Dr. Rosati, who is new to our community as well, plastic surgeon. From France, we have Dr. Paye, who's also aesthetic doctor. We have Dr. Mehdi, welcome, who's a family medicine doctor. Dr. Mimi is also into aesthetics, I believe, from France. Dr. Belloun, I'm not familiar with Dr. Belloun. Perhaps you'd like to give an introduction.
Hi, how are you?
Hi.
I'm the assistant of Dr. George Belloun. He's currently in Venezuela, Caracas. He's a plastic surgeon, but I'm here for him because he's currently in surgery.
Okay, perfect. So welcome. And Caracas, okay, and plastic surgery.
Yeah,
perfect. So, okay, we work with a lot of plastic surgeons, so hopefully we give you interesting information as well. Thank you. Okay, anyone else who is new to our community would like to say hello? Isha Pudel, I don't think we've met before.
Hello. Yeah, so I'm a dermatologist. I'm from Nepal, Kathmandu, which is the capital city of Nepal. And I'm a mid-career dermatologist. I've been practicing from past 12 years, a majority of aesthetics. And since my beginning, I also do hair transplants. I'm a founder of the clinic named Aesthetic Aura Skin and Hair Clinic here in Kathmandu, Nepal. So that's all about me. Yeah.
Okay, thank you, Dr. Isha. We met on LinkedIn. So actually we're going to talk about LinkedIn. It's a great place where to meet each other. And welcome to you as a dermatologist. Hopefully there are some opportunities for you here in Dubai and useful information tonight. Thank you. Anyone else would like to say a quick hello, or shall we get started? Or if you have any particular questions, this is a very open discussion tonight. I have some slides and presentations for you, but you are welcome to interrupt me at any time if you have questions on this topic. And we also have a group chat. You can probably see it here, so I will check it regularly to see if there are any specific questions that you want to drop in the chat. Okay?
Hi, nice to meet you. I'm Cristina Rosati from Rome.
Hi, Dr. Rosati. How are you?
Hi, fine. Thank you. Thank you so much. I'm happy to hear from you. I've been following your page since a lot, and I'm very happy to have the possibility to join this meeting.
Thank you so much, Dr. Rosati, for following us. And hopefully we have a very nice group tonight of 10 doctors from all around the world. Many of you actually have commonalities. So we really try as well to introduce you to other doctors and people in our community. That's part of my vision, is that we're not just helping you to maybe get a DHA license or get a job, but we really want to introduce you to the right people and to some colleagues. So hopefully when you are here in Dubai, you get to meet each other as well. So
thank you. Thank you so much.
Thank you, Doctor. Okay, shall we start? Anybody has any more questions to share before we start? If not, I will go ahead and start the webinar. It's being recorded as well. Thank you. So the webinar is being recorded. So in case you have not the chance to follow everything, I will send you the recorded access afterwards. So for those who don't know me, I'm Servan. I'm French, and I moved to Dubai here in 2014. So it's been already almost 12 years that I am here. We always say that in Dubai time goes very fast, and I've seen the city change and the opportunities change. I've worked with doctors now for over 20 years. So before working in Dubai, I was working in the UK and the USA, and I was working with the American Academy for Anti-Aging Medicine, and I was part of the education and training of aesthetic medical doctors. So we've trained a lot of aesthetic physicians, plastic surgeons, and we've worked a lot with anti-aging and longevity medicine specialists as well. So since I've been in Dubai, I've had the chance to work with all types of specialties. So we work with radiologists, with dentists, with plastic surgeons. So we adapt to the needs of our clients. So I'm very happy to meet you and thank you for being part of my community. So welcome to you. This is an opportunity to get to know each other. Thank you for the introductions. So today I'm going to talk about a few things. I'm going to try and cover the most common questions which I get from the clients that we work with, whether it's the first phone call or whether it's 3-4 months later. Usually I get asked, what is it like to live and work in Dubai? So I'm going to talk about this. How can I practice in Dubai? What are the regulations and paperwork? What are the timelines as well? Is it easy to find a job, or shall I open a clinic? These are some of the questions I often get. What are the salaries? And what about taxes? Also, we get asked very often. Visas and requirements, and also lifestyle and living costs. So I'm going to try and cover as much as possible. Did I forget anything that is on your mind? Let me know. I think mostly the questions are about the job opportunities and the contracts. Any other questions?
No for the moment. Thank you.
Thank you.
Living costs.
Yes, living costs. Okay, we'll talk about it a little bit at the end. Okay, so I always like to share a little bit of interesting information about the UAE because some of you have been here usually for vacation once, twice, 3 times, but it's difficult to understand how does the UAE work and what is the ecosystem like here. So in the United Arab Emirates, it's always very interesting to be reminded that we only have a local population of Emiratis, which is 11%. So it means 9 out of 10 people living here are expats like you. So first of all, I always get the question, do I need to be fluent in English? Is it very important? And I always say, of course it's important, but remember that 8 or 9 out of 10 people who live here don't speak English by birth and are expats. So amongst the expat population, we have tens, if not hundreds of countries represented. We have people from Asia, from Europe, from America, from South America more and more. And it's a very mixed environment. So you will get to always bump into somebody that has come from another country when you live here. So the UAE population by age, I'm sure that when you've been to Dubai and UAE, you have noticed that it's a very young population, right? So in fact, 68% of people who live here are between 25 to 54 years old. So the 65 years and above are currently only under 2%, but I really believe that this is going to change. Few years ago, when I was living here, my friends and family were always used to say we will never retire here. We have a plan to leave in a few years. But this is changing. We can see that most of us now are making longer term plans, and the government is making a lot of plans as well to allow us to have opportunities, for example, investment, retirement, security, visas, long-term visas that were not in place before. So I think that more and more expats will spend longer time here and perhaps even bring their parents here. We're seeing this trend where a lot of expats are bringing their elderly parents here. So that will impact on the elderly population as well. And a lot of expats are deciding to start families here. So we also have quite a lot of children here. In terms of the different emirates, so I often get asked this question. We all know of Dubai, but Dubai actually is not the capital of the UAE. The capital of the UAE is Abu Dhabi, which is only 1 hour drive, more or less, from Dubai. It's one long straight road. It's very easy to get there. We can drive, but there is no public transport. So that's why the two cities are still quite divided and separated. So there is no train, there's not many buses. So you just have to get there by car, but it's very easy. So Abu Dhabi, we'll talk a little bit about it. I often have questions about Abu Dhabi. Is anybody on the group tonight thinking of relocating to Abu Dhabi instead of Dubai?
Yes, if we found a good opportunity. Because I heard about unified license, I think.
Yes, there was an announcement about the unified licensing because, yes, my next comment was going to be that we have different emirates and this means that it's different regulations. So think of it like each emirate is almost like a different country or like a different state, like in the United States of America. So if you have a license to practice in Dubai by Dubai Health Authority, that does not allow you to practice in Abu Dhabi. You have to apply for a separate license. But there was an announcement, you're right, doctor, that the licensing process would be unified, but it's not really active or in place yet. So this is quite common here in the UAE. We're having announcements. Overnight, we wake up in the morning, there is new announcement, but we don't know when it will officially take place. So it's not completely active yet. So at the moment, if you want to practice in Abu Dhabi, the regulatory authority is Dubai the Department of Health, DOH, whereas in Dubai is DHA, Dubai Health Authority. Does that make sense?
Actually, we cannot convert our license from DHA to other emirates.
It's not strict, yes, doctor, but strictly speaking, they don't call it like a conversion. So you still have to go and apply for Ministry of Health or Department of Health. The good thing is that data flow, the verification process is the same process, so it should be less long. Yes.
Okay. Just the exam.
Yes. Yeah. Yes. Also, that's the important point I wanted to make for the aesthetic doctors that we have with us tonight. So by aesthetic doctors, I mean usually the general practitioners or family medicine doctors. A lot of the aesthetic specialists are practicing under one of the two licenses. Dermatologists and plastic surgeons is different, right? It's a specialty. But for family medicine and general practitioners, it's very important to know that in Abu Dhabi, it's not yet legally allowed if you're not a dermatologist or plastic surgeon to practice aesthetic medicine. The rules are not so clear, but still to this day, it's not officially recognized.
Okay. Thank you for that.
You're welcome. But this I'm sure will change, but Abu Dhabi is very protective of the competition, whereas Dubai is very open with the competition. So Dubai allows you to open a clinic very easily. Dubai now is allowing any medical doctor with a DHA license to do aesthetics, whereas in Abu Dhabi, they are controlling the number of clinics that are in the same geographical area, and they're protecting a little bit, let's say, the scope of practice of dermatologists and plastic surgeons.
What about the others, Emirates? I mean, Sharjah, Amman.
Yeah, so all the other 5 emirates that you can see on the right side, Ajman, Al Quwain, Fujairah, Ras Al Khaimah, and Sharjah, they are all under one authority, which is the Ministry of Health, MOH. And as far as we know, yes, the GPs and family medicine doctors can practice aesthetic medicine in those emirates. So, you know, the choice to go to one of those emirates is very dependent on your lifestyle. This is a very personal choice that, you know, we can guide you in terms of the opportunities, but it's a personal lifestyle because they're a lot more traditional, they're a lot more quiet pace of life. So it depends. Why are you choosing to move to the UAE and, you know, your personal preferences? But Fujairah, for example, is a very developed emirate, same as Ras Al Khaimah. Anybody has heard about Ras Al Khaimah tonight? What comes to your mind if I say Ras Al Khaimah?
Tourist, mountain.
Yes. Yeah. Yeah, so it's actually, you get a lot of mountains, we get a lot of tourism in Ras Al Khaimah. They just go to Ras Al Khaimah. Usually it's more like resort hotels. But also
the weather is, I think, more cold.
Yeah, in the summer we all like to go to Ras Al Khaimah. It's a few degrees less. And also, you know, what's very important, have a look after this webinar online. You will see so many interesting things about Ras Al Khaimah. So the news is that Ras Al Khaimah is already getting built and constructed to become the next Las Vegas. So Ras Al Khaimah is going to officially allow casinos. So this was like a big news because it means that all the Chinese tourism is going to come to Ras Al Khaimah. They're building some of the biggest hotel resorts that we've ever had in the UAE in Ras Al Khaimah as we speak. A lot of people are buying properties in Ras Al Khaimah and investing because they're forecasting that this will be a big hub.
How much the population in Ras Al Khaimah?
I'm not sure, doctor. I think in Dubai we have 4 million. We will talk about this. I think Ras Al Khaimah less than 1 million or 1 million maybe currently.
Not too big markets.
But, you know, a lot less competition. And quite nice lifestyle as well, you know, more quiet. You don't have all the luxury things so much that we have in Dubai. But for sure, like still a good population, and it's also by the sea. So it's worth thinking about. It's a personal decision.
How much the distance between Ras Al Khaimah and Dubai?
About 1 hour and a half.
Okay. Good.
Okay.
Yes.
So we have a lot of aesthetic doctors that, for example, I will talk about this, but you know, when you have a license so you could have a license with Dubai Health Authority, and have a license with Ministry of Health. So you can have 2. Okay, you can combine them. So if you have your license with the Ministry of Health, you can practice in Ras Al Khaimah or Sharjah. So some doctors choose to do maybe 3 days a week in Ras Al Khaimah and 2 days a week in Dubai. It's an example.
Yeah, okay.
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 Okay, so in terms of having a look at, okay, I have the data. I forgot. I added this the last minute. So this data is from last year. So the numbers are lower than currently. There is very little data or official statistics generally in the UAE. Even as doctors, you will see that research and scientific evidence is not so published here. But these are numbers from last year. That's all I could find. So Dubai here last year was showing 3.7, but already we are at approximately 4 now in 2026. Okay, so the numbers are growing. Actually, as per this, it was more or less the same with Abu Dhabi. I don't know in 2026 what's the latest data, but here it's showing Ras Al Khaimah 345, but I'm sure this is increasing by the day because of the construction that I was mentioning.
Expansion, yes. They have not planned like Dubai 2014, Ras Al Khaimah?
2040?
Yes.
I don't know what is their long-term plan, but I'm sure there is one, doctor, because as I say, you know, the opening of the casinos and all the big resort hotels, you know, from Vegas and internationally are being built now already. So it's worth checking online. Okay, so this is just showing the growth of Dubai from 2023 to 2024 and 2025. So it's been a very steady growth. And we are seeing that growth speed up every day. I think I read that every day approximately 600 people are moving to Dubai. So yes, Dubai is still growing, if that is a question on your mind. This is actually an interesting data, so I think that's what you were referring to, Doctor. There's something called the Dubai 2040 Urban Master Plan by Sheikh Mohammed bin Rashid Al Maktoum, and he announced it in 2021, and he's saying that the target population by 2040, so 14 years from now, is 5.8 million. Sorry, only the 8 is in red, it should be 5.8, and we're currently at 4. So you can see the growth that is expected. So Dubai or Abu Dhabi, we actually already discussed it. Okay, so now we'll talk a little bit more about the medical ecosystem of working here as a doctor. Okay. So here's a little bit of data. So in Dubai, as of today, we have 1,800 clinics, including 1,000 aesthetic clinics. Not 1,000 exactly, but it's literally 1,000 plus. We just exceeded 1,000 recently. And we have 55 leading hospitals. Okay, so in Dubai, we make the healthcare system is mainly divided between the hospitals, where we have all the surgical specialties, the emergency, and usually there are huge chains of hospitals, and they might have 3, 4, 5, 6 branches under one name. So for example, we can take Mediclinic as an example, or Saudi German Hospital, for example. These are well known, or Medcare. So any of those names of hospitals are very well established, and they will have usually different hospital branches in each neighborhood of Dubai. So the hospitals are, of course, where, as I said, you have all the specialties, you have the emergency, you have many operating rooms, and generally speaking, the hospitals, of course, work with insurances, and they welcome patients that have insurances, and they don't need to pay upfront. It's already covered by the insurance, so no upfront payment. And usually, of course, hospitals will have a much higher volume of patients, which means that as a doctor, of course, it's not applying for aesthetic medicine, because usually these hospitals don't have aesthetic medicine within their department. They might have a few lasers, there might be 1 or 2 dermatologists there registered, or more, and they will offer a few cosmetic orientated services, but it's mostly clinical. So So if you work for the hospitals, you will have a higher volume of patients if you're in the mainstream specialties. And we'll explain later on that usually you'll work on a fixed salary basis, more like an employee status. If you're working for a clinic, so what we call a clinic is still usually it can be big. It doesn't mean that it's small, but usually we call them polyclinic and they have multiple specialties there. And usually the main difference between clinics and hospitals is that the clinics, they don't tend to work so much with the insurances. It's not always the case, but the clinics generally operate more like a private model. And the clinics would be more like the dental clinics, the aesthetic medicine clinics, physiotherapy, chiropractors, plastic surgery clinics. And usually these don't work with insurance. Of course, the patient have to pay cash and usually there is no reimbursement. Or if it's dental, for example, of course, there will be reimbursement, but that will be the patient's responsibility. And as I mentioned, we have 1,000 aesthetic clinics currently in Dubai, so it's a very high number. There's a very big trend at the moment that aesthetic clinics are opening very frequently, so it's quite easy to open an aesthetic clinic. The main challenge is how to build your visibility and bring the patients to the clinic. This is where the investment has to be if you're thinking of starting an aesthetic clinic. Are there any questions about the organization of the healthcare system between the clinics, the hospitals, private versus public? Any questions?
There is no, not clinic. There's no, small office, let's say, cabinet médical.
Yes.
In Dubai one doctors.
I understand you. Yes. So it's not exactly the same as we find overseas. It's less common. So generally, yes, either you open your clinic, but it means, starting a business per se, or you work in a hospital as an employee, or there is like this new model coming up where you can rent a room in a clinic. So, but usually the clinics that offer this, actually, they also have doctors there that are on salary. They also have some doctors working part-time or full-time, and maybe they have 1, 2, or 3 empty rooms in the clinic, and they will decide to rent it to a doctor. It means that in the rental price, you will be able to use the reception service. Maybe there will be a nurse service, and of course the rent and all such other things. It is available, but it's less common, I think because of competition and the need to be visible. So if you do this, you have to, of course, do your own marketing and get your own patients. And if you are in somebody else's clinic, it may not be as easy to do that. But it's available. Yes. And there is actually one place in Healthcare City that is only doing this. So they're almost like a sharing space for doctors where you literally rent your room, but everyone there is just renting the room and using the reception service. So there is like now one official place doing that.
Thank you.
So probably you are aware of this. I am breaking any truth, but in the UAE, it's very important to realize that healthcare is a business. So it's very much like the American USA concept where healthcare is a business. It's very expensive. Either you have insurance or you don't have insurance. And if you don't have insurance, which by the way is not legal, so every employer has a duty to give insurance to their employees. So strictly speaking, everybody should have an insurance, but for whatever reason, if a patient does not have insurance, it's going to be very difficult and expensive to get care. So healthcare is also a business because most of the clinics and even the hospitals, their main priority is, of course, to provide excellent medical care, but it is also definitely to make money. So running a hospital or a clinic here is very expensive. And we can look at healthcare the same way that we look at education. So if anybody has kids in our group, I'm sure you might have looked into the cost of the schools here in Dubai, and you know that school fees are expensive. Why? Because education is also private and it's actually also a business. Anybody has any comments or questions about this?
That's my issue, the kids.
Yeah. The cost of the schools, you mean?
Yes.
Yeah, it is very important to factor in the cost of the schools in your budget. Of course, there's different pricing available, but usually we want the best for our kids and we want the best schools. So it's important to go and see those schools beforehand, and, you know, sometimes maybe that will impact also the geographical area, the neighborhood in which you will be able to live, because if you pick a particular school, maybe it's not available in another area. So it means you have to focus also your job search in that area in order to avoid too much commuting and traffic. So it's important to come to Dubai with this mindset that, you know, it's a business. So your mindset has to be on the same level. You continue to be a great doctor. That is not going to change. You're going to use your clinical skills. The better you are at what you do, you know, the easier it will be for you to build a good, healthy patient base, for your patients to refer you to their friends, to their family. This will work the same. We all want amazing clinical care, and actually our expectations as patients here in Dubai are even higher than elsewhere. So, you know, excellent clinical skills is important. But you also have to come with this mindset. Okay, I have to establish myself here, and I have to build a business for myself. I have to build a patient base. I have to build a reputation, and I have to build this visibility for myself as a doctor. We will explain to you how to do that. And of course, we provide assistance for this as well. So I often get questions about the insurance system. I already spoke about it a little bit. I think this will depend on your specialties. I think we have a lot of aesthetic doctors and plastic surgeons here, so it's not subject to insurance. If we have any other specialists with us tonight that has a specific question on this, please let me know. Otherwise, I often get asked about the malpractice insurance as well. So in terms of your own insurance, actually in Dubai, this is not as complex or expensive as it can be in certain countries for your insurance. And the malpractice insurance is the responsibility of the clinic or the hospital. So they will handle it, they will subscribe, and they will pay the costs. What about healthcare insurance for yourself as a patient? So as I mentioned, assuming that you will have a contract, employment contract with a clinic or hospital, they have a duty to provide you with healthcare insurance as part of the law. And there are different categories basically of insurance that they can view. Let's say premium, standard, and basic. And usually, depending on your status, they will give you access to a particular network of hospitals and clinics that are more premium than others. So usually, you know, the lower the status of the employee, the lower the grade of the insurance, and the higher the status of the employee, the higher access to premium network you will get. So I mentioned as well that cash paid medical care means that doctors need to be visible online in order to be found and selected by patients. Okay, so as we said, in hospitals, usually there is insurance, so they are managing the flow of the traffic because they're on the insurance books. If you're working in, let's say, a more independent structure, like in a clinic, patients will pay by themselves. The clinic is likely to not work with the insurance. So, of course, when you pay for a service, even if it's medical care, you become more picky, right? So you start checking out the clinic reputation. You start checking out the doctor's reputation. So there's a lot of research that happens online by patients before they spend their money on a doctor, on the medical service, or before they choose to go to a particular clinic. Okay, so I'm going to move on and talk a little bit about the licensing process. Now that you have a bit of understanding about how it all works here in Dubai, we're going to talk about the boring part, which is paperwork and regulations. So as we mentioned in Dubai, the I had a question, sorry, 1 second. In the clinic sector, can a surgeon be a freelance professional, or must they be employed for the clinic and paid with a salary by the clinic? It's a very good question, and I will discuss it in more details shortly. But yes, usually for surgeons, they don't like to work on a fixed salary basis and employee status in Dubai. So you will have a contract with the clinic to say that, okay, you are working in my clinic and you will receive patients and you will use our operating room. But usually there is an agreement that the fees paid by the patient for the surgery will be split between the clinic and the doctor. So we call this a revenue share agreement, which is not a salary agreement. So essentially you are independent, but your license of DHA is linked to that clinic, and there is a contract, of course, for legal purposes, but you're not an employee status per se. So in Dubai, of course, if you want to come and work, you need a license. I'm sure you're very aware about this, by the Dubai Health Authority, which we all call here the DHA. So we already spoken about this. Each emirate has a different licensing and regulatory system. It's very important to remember this. I often get asked the question about the exam. Do I need to take an exam in order to get my license? And I'm not going to lie to you. A lot of doctors decide not to move to Dubai when we answer them that, yes, you are eligible for an exam. You are required to sit an exam. So how does that get decided? The main criteria for whether or not you need to sit an exam is based on tiers. Tier 1, Tier 2, Tier 3. You might have heard about this before. So how DHA did it is they looked at countries where medical degrees are regarded to be in Tier 1, countries where medical degrees are regarded to be in Tier 2, and countries where medical degrees are regarded to be in Tier 3. And each tier has a number of countries listed. So, for example, UK, Australia, USA, and France, I'm French, we have a lot of French clients, is exempted from the exam generally. Okay, why do I say generally? Because maybe if you graduated some years ago, like maybe 15, 20, 25 years ago, it will depend. Maybe your particular diploma that you obtained, even though it's from a tier 1, may not be on the list because, of course, systems evolve and duration of studies evolve. So they might say, yes, you are from this tier, but you still need to take an exam. But generally speaking, 80 to 85% of doctors from tier 1 do not need to sit any exam. Tier 2, we have, unfortunately, all the other European countries. So it still is a surprise to many doctors from Spain, Italy. Sorry, Dr. Rosati, but yes, generally you will need to sit an exam. But again, the consultants and the specialists may be exempted from that. So what we do is we do an eligibility review for you. If you're not sure whether you're subject to an exam or not, we just ask you a few questions, ask a few documents, and we can generally predict very accurately. If you will need to sit an exam, there are two options. The Prometric exam, which means it's computer-based with multiple choice questions. You can do it from your country. So even if you are in Spain or Venezuela and DHA tells you have to take Prometric exam, you go to one of the exam centers in your country. Or you do an oral exam, which is by Zoom, with some of the board of examiners from the DHA. And usually this is a better option and easier maybe because they will ask you, they will present you a case and they will ask you how would you treat this case. Any questions about the exam?
Yes.
Yeah. Okay.
Hi, how are you? Here from Dr. Bailuni. The Prometric exam, I mean, do you have the option to choose between the Prometric and the oral exam, or they have to check your case and they will tell you, oh, you can only do the Prometric, or you can do both or whatever?
Yeah, actually everything is already predetermined. There's like a big book of like 50 pages of regulations and tiers and who takes what. So it's already predetermined. So it just depends, like I said, where you graduated, what is your medical specialty, and if you're a specialist or consultant. I will talk about the difference between the two. So we can have a chat later on about Dr. Bellune, and I can ask you a few questions, and I can tell you whether it would be prometric or oral.
Okay, thank you.
You're welcome. Nice to know that you do have several attempts. So usually, it's not easy. Like I'm not going to lie to you. The prometric exam is like any exam. Exams are not always based on practical knowledge. They're based on academic knowledge, textbook knowledge, from books or data that is a bit old sometimes. But you have several attempts. So you can try 3 times for each exam if you fail. And the required pass rate is around 60% usually of correct answers. And of course, there are ways that we can help you to prepare, and we will explain, what are the reference books that you need to look at, practice questions and how the exam is structured as well.
Great, thank you.
You're welcome. We also have doctors who sat the exam and passed the exam, so we can put you in contact with them.
Great, that's great.
You're welcome. So there is another question. Is it necessary to submit a certificate proving the level of English language? No, it's a very good question. There is not that requirement, actually, which is a little bit surprising. But, actually, they're indirectly checked via the exam if you are subject to an exam. So with the prometric exam, you're not allowed to have a dictionary. But, anyway, it's mostly medical terms, so usually doctors are fine. And with the oral exam, it happened to one of our clients who was osteopath. And usually the osteopath or chiropractors, they have to take the oral exam, not the prometric. So he did the first exam, and actually they failed him because of the English. And they said, no, not pass, because the level of English in the oral exam is not good enough for being able to converse with patients. And the osteopath told us it was very early morning, I was not focused, or I didn't wake up properly. I will try again. And then the second time he did the exam again just 2 weeks later, and he passed. So they're not expecting very high level of English. They just need to see that you are confident to handle a conversation with the patient. I had read that I needed to submit a certificate. Yeah. No, I never had that situation. Okay.
Thank you.
You're welcome. So some of the main criteria for you to get the license. So, of course, have a medical degree that is recognized with a specialty degree. And it's important the number of years of study. It's very rare, but sometimes, maybe your medical degree is 4 years, but they recognize degrees that are 5 years in duration. So we always have to check what degree you have, where you studied, and how many years was your degree. Country that you studied. Number 2, do you have an active license in any country right now? And making sure you don't have any gap in practice, or at least no big or multiple gaps in practice. You need to have recent experience or employment letters. The number of years of experience that you have is also important. So, for example, we get a lot of young graduates that just graduated. Usually, unfortunately, we cannot apply for the license immediately, because there is a requirement, depending on the country, between 2 to 3 years of experience after graduation. First, you need to gain experience in your country before coming to work and practice in Dubai. Is that clear? Any questions? Yeah.
Yes. What about the requirement to practice aesthetic as GP? Okay. Because I found too much yes. Offer. They talk about GP aesthetic privilege. What's mean privilege?
Yes. Okay. This is a very good question. So the privilege means that you don't need a special license for it. You just need your GP or family medicine license, but you need to have the privilege to do aesthetic medicine, which means that the clinic where you will work, there is always a medical director in the clinic, and that medical director has the authority and responsibility to give you a privilege to perform aesthetic procedures. That gets recorded in the books of the clinic. How does he give you this? Basically, it's supposed to be based on having done a training in aesthetic medicine, which is from one of the recognized bodies. So, for example, American Academy of Aesthetics Medicine or American Academy of Anti-Aging Medicine as an example.
Just certificate or board is required?
Just a certificate.
Okay.
So basically the institute or the organization giving the certificate has to be recognized, and usually they like to recognize the ones locally here in Dubai that have the international backup. So for example, American Academy of Anti-Aging or Aesthetic Medicine, they're here, but they have, international presence. So this is usually a good thing. Just to let you know that lately, there are rumors that they are contacting the training centers, and they're saying from now on, the trainings need to be, 15 days instead of 5 days. So these are just things that maybe will change in the future, but for now, it's nothing new. You just need to have a training and keep it, show it to the medical director, and that's enough.
I mean, that's not an exam or something like this? Okay.
No.
Okay, thank you.
Is there a letter of recommendation from a hospital or clinic a must? I have been working, no problem. So if you are self-employed, which is the case with 80% of our clients, you just simply create a letter that we show you the template, and on the letter you will explain that you are self-employed, and we work with you to make sure that the letter usually has to be signed by a third party, which is much better. It can be your lawyer, your accountant, like your manager in the clinic that works for you. But there needs to be a letter that is written that shows you are employed or self-employed. But we help you with this. Okay. Timeline. So we often get these questions as well. So when you start the licensing process, we do in our agency, different agents work differently. But in our agency, we do a preliminary approval, which takes 1 month, and it's an official approval by the Dubai Health Authority based on your documents and degrees. So then this is a very viable preliminary approval that we can rely on. And after we have the preliminary approval, we go to Dataflow. So sorry, the slide is moving automatically. So Dataflow is a third-party organization that works with DHA and will contact each of your authorities, your university, your medical council, and they will check that all the documents and degrees that you gave are authentic. So this will take about 3 months. And then maybe after Dataflow, you take the exam. If you're planning to search for a job, we allow you to allow between 3 to 6 months just to be safe. Sometimes you can find something in 2 or 3 months, but sometimes, especially if you are not in Dubai when you're searching, it might be a bit delayed. I'm so sorry for the moving. And building your name in the market, really, this takes 12 to 24 months, if I have to be honest, because when you come to Dubai, you are new. Nobody knows you. You might have a few patients or friends that will come to you, but really before you are up and running and you start to have a name, when people search online or word of mouth, it will take 1 to 2 years. We have to be realistic with that. So let's get to the section about finding a job in Dubai. So one of them, yes, is there a question?
You say that we need the 12 months to build visibility. Mm-hmm. You mean that if I come to Dubai, I will don't work, I will don't have patients in the first months?
Of course not. But what I mean is that before you are able to say to a clinic, let's say, yes, I have patients, I have loyal patients, I have an active social media page, I have my website. Usually these things will take 1 to 2 years to build. It doesn't mean that you cannot start working, but that's the difference, let's say, between starting work as a new doctor that nobody knows you in Dubai yet, but you're working for a clinic that wants to have your skills and your personality in your clinic, so they will onboard you because their clinic is up and running, they have patients, they will onboard you as a new doctor. By the time you start to build your visibility, if you're taking it actively, this takes 1 to 2 years usually.
Okay. Okay.
Okay.
Thank you. Thank you.
So you're welcome. So one of the common questions is, shall I work part-time or full-time? You can do what you want, of course. DHA allows you to work part-time, and DHA allows you to combine up to 3 facilities. So as I mentioned before, you could work, for example, in a hospital part-time and in a clinic part-time. You can work in 1 facility full-time and 2 other facilities part-time. Okay, maybe if you are a specialized doctor, we have the case with plastic surgeons. Maybe in 1 clinic you are focusing, I don't know, on hair transplant. But maybe the other clinics, they are very well known for body surgery. So you want to split your time and your activities between 2 facilities. This is possible. But if the question is, okay, I'm in Italy at the moment, or I'm in Venezuela, and I want to come to Dubai, but not full-time in the beginning. I want to come to Dubai maybe 1 week per month. I want to come and I want to go back to my clinic until it's safe and I have patients and I can move. You can. But
yes, that's a good question. Yes, that's what I would like to ask. Thank you.
Yeah, you're welcome. So we often call this visiting doctors. In case there is anybody who already heard about visiting doctor and thinks or heard that
that's allowed, like you have to have the residency, like how is it working?
Okay, yeah, it's a good question. So when you visit, the residency will depend on your country, your passport, so your nationality. So I will take the example of France. It's easy because we have easy rules. So you could come as a visiting doctor with no resident visa in the beginning. Because when you come to Dubai, you get a stamp that you can stay in Dubai, for example, 30 days, 60 days, 90 days. So if you come for 1 week, you are fine, right? But let's say if your country is not allowing free entry visa, then the clinic or hospital where you go for 1 week a month will process your visa. This is not big headache. We have a lot of questions about visas, so you have few options. Either the clinic where you work will process the visa, which means you will be on the clinic's visa. This is how we call it here. So it will show that Dr. Bellone is sponsored by Beverly Clinic, okay, for his visa. If you don't have a contract with a clinic, but you just want to come, I don't know, for job interviews, for searching, you need to use the tourist visa in the meantime. Or also we have some doctors that like to have their own visa. What does it mean to have your own visa? It means that you don't need a sponsor like your employer, your clinic or your hospital, and you have your own visa. How to have your own visas? There are different ways, and I can explain if this is an interesting question for you. Maybe you or your spouse has a business as well, and you will be registered as a business visa. Again, like very often we have doctors that their husbands have a business, for example, and the company will give them a visa. That is okay, but you just need to be careful because there are some clinics, depending where they are located geographically in Dubai, that if you have a visa on like a company, you are not allowed legally to work in a clinic. So there are a few rules to bear in mind. There's also something called golden visa. Maybe some of you heard about that. Dubai is giving golden visas of up to 10 years, unlimited now, to some investors, doctors, people who have real estate here. So the criteria are changing very regularly. You need to check if you are eligible for that.
Freelance visa.
Freelance visa, no, it's not for you. It's not for the doctors. Yeah. So I would say whether it's a good decision to come and go, it will really depend on your specialty and mainly your specialty. Because if you're a plastic surgeon, it's doable. You can do it. You can come and go, especially if you are a plastic surgeon and you're very specialized in something that the clinics here, they will say, yes, we were looking for this type of rhinoplasty expert, for example. So you will come, they will announce you as the big expert coming from Venezuela, and then you will see some patients, do the surgeries and go. Sometimes the question is with the follow-ups, because if you are not here, it's difficult for you to do the surgical follow-ups, but in that case, it's important to be part of a team and that your colleagues can do the follow-ups. But if you are, I will be honest, like aesthetic doctor, dentist, the clinics now, they're a bit less enthusiastic about the part-time or visiting basis, because they feel that, okay, the doctor will come for 1 week and then he will leave again. So, when the patient is calling and they say, I want to book with this patient, we will say he's only available on those dates. They will lose some business. Patients, they want to come, you're not here. So for the aesthetic medicine, the clinics, they like to have someone full-time. Unless, again, you have a profile which is a bit niche, interesting, some interesting procedures you're doing, and, you really like each other, you match, they can do compromises and say, okay, you will come just part-time. Maybe it will be better for the clinic initially because maybe they don't have enough patients to fill up your agendas and books for like full-time. So sometimes it can work. Sometimes they need an extra doctor, but not full-time, just part-time, but you have to see what is on the market. Does that answer your questions?
Yes, thank you.
You're welcome. Okay. Salary and contract models. So let's talk about the contracts first. So if you work in a clinic, you need a contract. Doesn't matter if you're on fixed salary or if you are independent with what we call percentage-based and revenue share, there needs to be a contract. It's the law. So you will have a contract with the clinic that you agree to come and consult patients, operate on patients, and this is the financial agreement between the doctor and the clinic will be listed in the contract. Okay? If you are a doctor receiving a salary in the clinic, the contract will list many other things. The contract will list your entitlement for holidays, annual leave, healthcare insurance, visa, and all other such things will be listed in the contract. We refer to it as the labor contract. If you want to look online, it's the official document which is regulated by the Ministry of Labor, and all the clinics need to give you this contract. Now, the salary. So salary, there are mostly two models. Fixed salary, which means that you will work for an agreed number of hours. In Dubai, it can be up to 48 hours per week. 48 hours per week maximum for this salary. Or you are a type of doctor, maybe like we said, the plastic surgeons, or maybe you already have some patients here or some visibility, and you say, I don't want to work on fixed salary because I will come, I will have patients. Maybe the clinics will also have patients, but I don't want a salary. I prefer to have a percentage. We call this here usually the revenue share. So the revenue share means that you agree on the contract with the clinic that for every procedure that you do, there is a split. So what are the splits usually? So if you don't receive a fixed salary at all, the split starts at 50-50. 50% for the doctor, 50% for the clinic. After the deduction of the cost. For example, there is a surgery for $5,000 and the operating room of the hospital is costing $1,000 and the consumables is costing $500. So there is $3,500 left. $3,500 will get split, 50% for the clinic, 50% for the doctor. You can negotiate this, and sometimes if you, again, somebody that the clinic thinks, yes, we can do good business with this surgeon or with this doctor, or maybe this doctor already has good visibility here. We can see that he's active on social media, he has a website. We think, or they can see that you're the type of doctor that will generate good volume of patients for them because of who you are, your technique, your protocols. You can negotiate up to 60% for you or up to 70% for you. 70% usually is the maximum. It happened that some of our clients, they said, I will not do it for less than 80%. You will not find. Trust me, you will waste your time. You will not find a clinic that agrees to give 30%, 20%, that will agree to keep 20%. Because the costs in Dubai are high to start the clinic, to rent the clinic, to have the receptionist, the nurse, everything is costly. So usually they will not agree to do it for less. Any questions? Do you want me to talk about average salaries, which is a very difficult conversation because in Dubai, you know, the market is changing all the time. I always say that the salaries of doctors in the medical field can be like real estate, up, down, up, down. It will depend on supply and demand. So if there's a lot of doctors of your specialty in the market currently, the fixed salaries will be low. But if there's less doctors like you, the salaries will be high. So let's talk about dermatologist. A dermatologist, not a family medicine doctor or GP, but usually dermatologist, specialist or consultant, the salary can start around 40,000 dirhams per month, which is about $11,000, $12,000. This can go up to 40,000 dirhams, 45,000 dirhams, 50,000, 55. The more you have, again, visibility, patient base, the more you're active, the more your salary goes up. It's not necessarily with your skills, unfortunately, I will be honest, that the salary goes up. The salary is often based on how busy you are as a doctor. Okay, and of course, again, if you're highly specialized in your field, then this will reflect. But otherwise, it will be dependent very often on whether you're a consultant or specialist, the country you are from. I have to be honest with this as well. Like certain countries, like, I don't know, UK will take the obvious, you know, UK doctors here are highly sought after and usually they have quite higher salaries. So plastic surgeons, the salary, if you work full-time with a clinic, the salary usually is starting at 75,000 dirhams per month, which would be about $20,000 fixed salary. And usually you always get a percentage on top of your salary, which is for each procedure you do, they might give you 5% or 10%, but it might be subject to a target or a threshold as well. If you are an aesthetic doctor, which is a GP or family medicine doctor, and you're doing lasers, fillers, Botox, fixed salaries of aesthetic doctors in Dubai right now are a bit crazy. They can start, here we say it's low, they can start around 20,000 dirhams, which would be about $5,000-6,000 a month fixed without the commissions, but they can go up to double. They can go up to 10, 12, 13 without the commissions dollars.
And what's the common model? Is fixed salary or salary with the commission?
So usually there is always a commission structure built into the contract, but the commission, if you have a fixed salary, will be less. It will be 5% or 10% subject to some targets. So if you reach, for example, I don't know, $50,000 a month, you will get 5% of this on top of your salary.
So the commission is always in the contract?
Yes. The commission has to be negotiated before, yes. Yes. Of course, we can talk about the salaries if you would like in private. I will explain at the end. We can have a private consultation in the next few days, and we can do a private eligibility for you and assessment. Okay, how much can I earn? We already discussed this, and of course, each person is different, so we can discuss that later on. So finding a job in Dubai, here's a few tips from me. Of course, the Dubai market works very differently than any other markets, and jobs come and go fast. I want to explain this a little more. So if you tell me, okay, now we are January, and I want to start a job in Dubai in May, can we start looking now? I will say no. Why? Because a clinic here or hospital is not planning that much ahead. If they need someone now, it's because somebody left the job. So therefore, the notice periods here in Dubai are usually 1 month. So if a dermatologist is working in the hospital and left the job, the dermatologist would have given the hospital 1 month notice. So the hospital has 1 month to replace that dermatologist. Or maybe they're expanding the team. If they're expanding the team, they will have a team meeting and they will say, okay, we have budget and need for an extra doctor. Okay, they will inform the human resources team immediately, and the next day or next week they will start publishing it and they will say immediate start. It doesn't mean that you will start immediately. Sometimes there are delays with paperwork, contracts, but it's very difficult to convince a clinic or hospital to interview you if you are not available in the near future. Okay? So the jobs, they are published, and sometimes the next day they are not published anymore. So we have to be quite fast and reactive. It's good to start looking before, of course, and I always say don't be shy of applying. Here in Dubai, it's common to receive hundreds of applications for a job. So if you just want to test the waters and send your CV and profile for an interview, do it. And then worst case, you can't go, but you get an idea, that's fine, nobody will stop you. I would say that it's very essential for you to be on LinkedIn. Personally, I am a big fan of LinkedIn, and I think for you as doctors, it's quite easy to use if we explain to you the steps. It's not a place like Instagram, where Instagram patients can find you. On LinkedIn, it's not for patients to find you, but it's for employers to find you, for clinic managers and owners and hospital HR representatives. Everyone is on there. So in the beginning, it's very smart to start on LinkedIn and to create a profile and apply for jobs on LinkedIn and be seen on LinkedIn. Starting an Instagram profile is not a bad idea if you haven't got one yet, because here in Dubai, sometimes the Instagram profile is like your CV. It's happened especially for aesthetic doctors that a clinic will ask us, send me the Instagram profile of the doctor. And I didn't send the CV, but they want to see the Instagram profile. So this is an entire separate discussion. At our agency, we're very active in the field of social media guidance for the doctors. We are not a marketing agency, but we help you to create a roadmap and plan your brand. So we can explain to you like what you should be doing on your Instagram profile in the beginning. And really, you know, the smart clinics, they don't expect you to have thousands of followers. This is not true. They just want to see that, okay, you have an Instagram profile, you have made a couple of videos, you know, you have a few, there's enough posts that give us an idea of who you are as a doctor. And be prepared to build a loyal patient base. So initially, when you're coming to Dubai for the first time, every clinic or hospital will know this doctor is new. He doesn't have patients here. It's normal. But once you've been in Dubai 1 year, 2 years, 3 years, and if you want to change jobs, at this stage, this question will come. So social media and personal relationships are very strong in the UAE. What are clinics searching for? So clinics, they search for doctors that have unique subspecialties or procedures that you do that maybe a lot of other doctors don't do. They don't always look for that. Sometimes they look for doctors that have a great ability to build rapport with the patients. So they want you to be friendly, approachable, conversational with the patients, and they want you to be able to build your visibility. We're again talking about this. They want doctors who can help the clinic to fill up the appointment books. So when they interview or look at a doctor, they will think, okay, is this a doctor on our team, that will help us achieve our goal to have a busy clinic? If you're an anesthesiologist, it's different. I get it. We've worked with anesthesiologists before, and for him, what's important is, okay, like, where has he worked before? What are the areas of anesthesia that he's confident in? It's totally different ball game, but I'm talking in general. Doctors who can differentiate them from the competition. So if you think that there are 1,000 aesthetic clinics, if you're an aesthetic clinic, you're going to choose your team carefully, right? So you want team members and doctors on your team that will help you to stand out from the competition. And doctors who are ready to invest in themselves and build the marketing. Hopefully, you don't get, let's say, scared by these discussions of visibility and marketing. It's not something that happens overnight. All the best clinics and hospitals know it and will be very reasonable with it. But it's something that you need to have on your mind for your long-term plan here in Dubai. So there are many ways to do it, and slowly but surely, So we're reaching the end of the webinar, so I just want to show you a little bit more about our methods. So at Invictamed, how do we work to help the doctors like you? So of course, we help you with the DHA license, but that is just, let's say, a small part of the big picture. So we help you to work on your CV, because we receive a lot of CVs that they're not adapted to the Dubai market. So if you think your CV is the most important, this is the one document that the clinic or hospital will open when they see your application, and they will only take a few seconds or minutes to decide, is it a good CV? Yes or no. You don't want to miss your chance. So your CV needs to be adapted to the Dubai standards, highlight your key skills, your personality, your certificates. So we work on the CV, we help you to work on the LinkedIn profile if you don't have one yet. And we also guide you on your online profiling and visibility, places where you need to be. We help you to secure many interviews as possible if you would like us to work together for the job search, which is an option, so that you can understand how it works here. It's important for you to realize that the best clinics and hospitals don't always pay the most, but they help you to build a strong path for your future. So I'm a strong believer in that, and the clients that we work with, we are always doing our best to help them decide, is this a good clinic or hospital where to work? And it's surprising, but it's true. Like, the best clinics, they know they are the best. And they know that they have a good career path for you. They know they have a good patient flow. They know they have a good reputation. They know they have a wide range of machines. So they've invested in many things. They will invest in having good doctors. They will pay them well, but actually they may not pay them salaries that are as high sometimes or competitive as a clinic which is brand new, doesn't have any reputation in the market, and really needs doctors to join their teams in order to get started. Those clinics initially have big budgets and they're willing maybe to offer a higher salary, but it's not always the best decision mid to long term. So I can talk to you more about this if you like this topic. And another tip from me is that remember that it's not always just the clinic who's interviewing you. It's also you who is interviewing them. So what do I mean by this is you have questions, you have expectations, you're making a big decision. So don't be shy to ask questions to make sure you're making the right decision. Ask them, how are they generating patients? What kind of conditions do they see in their clinic? What machines do you have? So have a list of questions and be prepared for that interview. We help you to prepare for this as well when we work together. Select a clinic with a good patient flow and do your due diligence check. So good patient flow is very important. There are many empty clinics in Dubai. Again, I don't want to scare you. There are many busy clinics, many successful clinics, but there's also many clinics that is just a facade. You go to their website, it looks amazing. You go to their Instagram, it looks amazing, but there are no patients there. So make sure you don't make a decision based on an online interview. Make sure you have a face-to-face interview with the clinic. Go to the clinic, meet the team, spend some time there and see how it feels. Like, what is it like in this clinic? And be prepared to negotiate on the salary terms. Remember, we're in Dubai, and the culture here means that negotiation is part of the deal. Is anybody interested or thinking to open a clinic?
It's
Not here.
Not yet.
big emphasis, please.
Sorry, doctor?
Not easy.
Yeah, it is not easy.
Big competition, yes.
Yeah, so it's not undoable. It's actually quite easy to open the clinic. What's difficult is to be successful and bring the patients and sustain the business. Many doctors were successful in doing it, but many recommendations and things to look at. It might be a good idea to have a partner, business partner, and there's many things to think of. It's another conversation that we can have, but you know, my recommendation is don't throw yourself in the deep end in the beginning. It's not necessary. Better to work with a clinic initially for the first year or 2 years as an employee. You're building your name. You see how life works here, how healthcare works, how does business work, what's the preferences of patients. They help you to build, you know, a flow. You will understand many things when you work for somebody and for a clinic here. So, but if you do want to open a clinic, I would say one of the very important things to think about is to think outside the box. Think of a geographical area where it's not overcrowded, where there's not so much competition. Offer something that is unique in the clinic, or if what you are offering is not unique, then take yourself away from the areas where there's a lot of competition, you know, so you have to look at different parameters. But overall, understand how marketing works here in Dubai and be prepared to invest heavily if you're planning to open a clinic. We do work with agencies that specialize in feasibility studies and business planning. So if that's what you want to do, we can help you along the way to make the right decision. I believe we have a question. How can we stay in touch? Okay, Dr. Rosati, I will be in touch with you. Thank you. So living in the UAE, we often get questions about lifestyle, administration. First thing that comes to my mind is it's very enjoyable. We feel very fortunate and lucky to live here. Everyone who lives here will have a smile when they tell you about life here. It's very safe. There is a very positive environment. We have great weather. The list goes on. You know, do we have traffic? Yes, we have traffic. Do we have taxes? Officially, no. But we have other costs that are not called taxes, but which, you know, are to be considered because it's quite expensive to live in Dubai. So one of the main costs, of course, is your property, whether you decide to buy or rent. Right now, the property prices is high because there's more and more demand, more and more investors from outside. So choose the area where you want to live carefully because property prices can double, triple, quadruple, you know, it can really go as high as you want, depending on the area where you want to live. Day-to-day life in Dubai is not more expensive than standard countries. You know, food in the supermarket is not that expensive. Petrol for your car is very cheap. There are many things actually that will be affordable, but there are things that are less affordable, like the schools and the rent, and these are big expenses that you need to account for. So, of course, you need to open a bank account, you need to have a visa, you need to choose the neighborhood. So this is a big decision usually. It's a personal decision, but there's so many communities now in Dubai, and we like to say that there's many cities within the cities. So it's not as easy as it used to be, for example, to go from the airport to the Palm or Marina. it used to take 30 minutes and now it can take easily an hour or an hour and 15 minutes. So traffic is to be considered when you choose your home location and when you choose where you work. There is no tax in Dubai for doctors or for individuals. There's only tax that has been announced for businesses. So whether you're a small or big business, we're now all subject to corporate tax. And corporate tax is set at 10% on the profit that you are making if you are a business. If you're a doctor working by yourself, like a plastic surgeon, it's not considered a business. It's still considered like an independent practice. So that will not be subject to taxes unless you open your own clinic. So some of the mistakes to avoid that we recommend is choosing the wrong clinic. This can be very disappointing for you. And accepting unusually high salary. I wanted to put this because, like I said, sometimes there are clinics that are struggling to hire doctors because they don't have a good reputation or whatever reason, bad practice, bad medical practice. And they might be very interested or desperate to hire a good doctor like you, and they will offer you a very high salary, but usually if it's too good to be true, it probably is. So it's important for you to be aware of the market standards and have those expectations. And one of the mistakes to avoid is not marketing yourself. We spoke about it. Choosing to ignore it, it will come back at you. So 4 of the platforms that I recommend you to consider getting confident and familiar with are Instagram. And we really don't want you to become, an influencer. It's just a basic Instagram profile will be more than enough, but it's important to just have one that shows you as a doctor, not a personal profile. A website is very important to consider, even if, you don't expect initially your patients to go on your website. It will help to build your online visibility ultimately. Networking is very important in Dubai. So we didn't speak about this, but especially if you're new, there's so many events in Dubai for doctors, workshops, conferences, seminars. If you're invited to any of those, go there, meet some colleagues, because word of mouth is very important here, and LinkedIn is also an important place. So that will be my final words. Dubai rewards those who move with strategy, not just hope. So it's important to have a strategy and long-term plan. So thank you for being with us tonight. If you'd like to book a personal consultation call with me, I do offer 30 minutes private, complimentary. We can do an eligibility review. And then if you'd like to start, we always recommend to start with the DHA first. So we help you to collect the documents. Later on, you can start building your visibility and marketing roadmap if that's something you want to look at, and then get ready for the job market. I will send you the link if you want to book the consultation. There's a calendar online for my diary. And I'd like to thank you for being on the webinar, and I'm available if you would like to ask any questions.